Okay, we're here. We're going to be doing a retreatment. Martha, if you want to zoom in and show the x-ray, it's tooth number 36. We do have a CBCT showing that there's a missed canal. So we are going to be taping this procedure. You can show it there on the screen now. I'm going to place a little bit of a sealant or a seal in order to make sure that we get no leakage. Thank you, Tony.
You're welcome.
We may not speak too much during the procedure because we're going to be concentrating on everything we're doing, even though I always say the same thing and I end up speaking a lot. Now we're going to be disinfecting the tooth or teeth, and we are going to be using peroxide and then hypochlorite. What did you say the symptoms were, Tony?
Pressure sensitivity.
Some pressure sensitivity.
Lots of noise and vibration,
Okay.
Peter. Close your eyes for this part. Lots of skipping sounds as well.
Okay, can I have the stroke cup, please, now? And let's go again with the beaver, please.
Peter.
How many canals do we have, Tony? 3?
3, I believe.
Okay, everything is done under the microscope and four-handed. Give me the ultrasonics, please, with water.
It's behind you, Dr. Mia. And it is at 3.
Okay,
And I will squirt water. You want water now?
water, please. Just using the ultrasonics in order to clean the pulp chamber so it gives us a better view of what we're doing. And we know that we're missing the mesiobuccal canal, so we're going to start looking for it. And I think we can see something there. We're going to try to see if we can get into the canal.
1 and 8, Dr. Nemias.
And give me number 8 now.
8.
And we have found the mesiobuccal canal. I'm not sure why it wasn't found the first time around, because it was quite easy for us to find it. So there is the mesiobuccal canal. And what is our predetermined working length, Tony?
I have 21 for the mesials and I have 20 for the distal.
So we can easily get to 21 in one shot. We don't pre-curve the files. I don't use pre-curved files from the beginning. And it goes all the way to 21 quite easily. Now, Tony, if you give me the stroke again, please.
Absolutely.
You get in. And give me the
7. Yep. You want the discovery or
the discovery, please.
Okay.
So we're going to use the discovery to just clean up some of the gutta percha that is at the orifice of the canals to be retreated. Just to clean up things a bit. Have to be very careful. We're going to just get a little better access to that mesiobuccal as well. Stroke complete. And we are going to start instrumenting a little bit the canal that was not found at first. So give me a little bit of calcinase, which is an EDTA solution that we're going to use as a lubricant. We know the number 8 went in without any issues, so Tony is going to pass me the number 10 on the M4, and this way we can start negotiating and opening the canal. We can bend it, go into place, and we're going to go maybe 2/3 down the canal. We're not going to go all the way down. This is more than anything to get rid of obstructions in the middle and coronal third of the canal. 2 seconds to do that, and now we're going to do the 15. Same thing. And you can show Martha how we pass things so people get an idea of how we're doing things four-handed. So I never take my eyes from the microscope. Everything is passed to me. I'm left-handed, but I work from the right-hand side because I find it to be the easiest way. I bend the file, so we've done the 10, the 15, and the 20, and the 20 just in the orifice because we want to open that orifice to at least a 25. So our wave 1 file, which is the primary, has a tip of 21, can go in to the orifice without any issues. Now we're going to rinse.
Blue.
And we're going to rinse with peroxide, followed by
Red.
hypochlorite.
Would you like Stroke?
And we're going to use the Stropco so we can see a little better what we're doing. This is our air-only dedicated Stropco. And we are going to use the primary wave 1 file, the red one. And at the same time as I'm doing this, Tony is going to be irrigating. You see, I can bend the file, gives me easier access to the canal. And we're just going to go into the 2/3, the coronal, middle third. And she's going to be using some water in order to remove some of the debris we're creating there. And we're brushing, and brushing to make sure that we are opening things in the coronal on middle third. This is a reciprocating file, so we're opening the middle third and the coronal third. Give me number 8 now. We always use a patency file to make sure that we can still get to where we were before. Now let's rinse, please. And we're going to start with retreating the distal. There's only one distal canal, and the mesiolingual canal that was
Red.
located before. Red, and then she's going to give me yellow. Yellow is alcohol. The alcohol
Yellow.
will dehydrate or dry the canal a little better. Okay, good. Really close. We always dry very gently. And we can see now where we had that mesiobuccal canal that was not located before. And we may open a little bit that area, the isthmus in between the mesiobuccal and the mesiolingual, looking for a third canal that we know is not present because our CBCT scan shows us that it's not present. Can you put the CBCT there? Okay. Give me the D3, please. The D3 is our retreatment file. I need to look at the distal, okay?
Sure thing. D3.
D3 is our retreating file. We're going to go maybe 2/3 into the canals. Only one distal, Tony?
That's what it's indicating.
Very good. That removes some of our gutta percha from there. And now you're going to give me the number 1 GG. We're going to open the orifices in the 2 canals that were treated. Just with a GG, just a little bit. We don't go far. We're just trying to remove some of the gutta percha. And now I'm going to get the number 2 GG. And you see, I'm not doing that on the canal that I found because I don't really need to use Gates Glidden once I've already used the wave one. And we're going to do number 3. Can we see things okay there in the monitor, Martha?
Beautiful.
And we're brushing a little bit against mesial walls, just so we have a direct line access to the canal. You see, we removed quite a bit of the gutta percha already. Now give me a number 10, and we're going to see how far we can get into those canals with a number 10 without having to use solvent. We can't get in that far. So this is the moment, although in the mesial buccal we can get as far as we want to. We're going to use solvent in order to start removing the rest of the gutta percha from the canal. The solvent is injected very carefully. And then we use a paper point to push it down a bit and to get rid of any bubbles that we may be getting with the solvent. Give me another paper point, please. And again, if you see how we're passing instruments, it's all passed by the assistant without me having to reach for anything. More paper points, please. And when Tony passes me something, she tells me what she's passing me, so we both know we're on the same wavelength. Give me a little bit of solvent now. Solvent. She's going to pass the solvent. And we're going to put it at the orifice of the mesiolingual canal and the distal canal. Now we're going to try a number 10 file. Okay. And for this, I may change my position a little bit here under the microscope so I can start removing with a number 10 file the material from inside of the canals. We know our length should be around 20-21, so we're going to try to get this file to that length. As soon as we use it a couple of times. If it doesn't reach its destination, that's okay. Now we're going to use another 10 file. We want fresh files all the time because they get clogged quite easily. And let's see what's happening on the mesiolingual. The mesiolingual, we're almost at 21. Actually, we are at 21. Now we're going to do the distal. Give me a number 8. Give me a little bit more solvent, please, Tony. We're going to apply a little bit more solvent. And what we use for solvent is we use chloroform, because we find it's the most effective of all solvents to remove gutta percha. And we just put it on the orifices. I'm going to use a number 8. The 8 appears to be going all the way down in the mesiolingual. No problems getting there. In fact, we can get it past. Now we're going to use another 8, please.
8.
And then you're going to give me a 15. With a 15, I'm going to open things up a little more in the coronal portion of both canals. And the distal is the same length, Tony?
I have the distal at 20, Dr. Nemias.
At 20. Okay, so we're going to use the 15. Almost like what we did with the M4. We don't push so far. We just want to remove some of the gutta percha that is in the canal. And now we're going to give me a 10, please. So we can go 8, 10, 15. 10. But the 15, never to be taken beyond what we think is how apical foramen. How are you doing so far? Very good.
Peter's doing great.
Well, we need to thank Peter for allowing us to do this, tape this case for him. Okay, give me the stroke. Now we're going to dry things. And we are going to now determine our working length with our apex locator. So Tony is going to hand me the apex locator. The apex locator that we use is the Bingo Pro. And Martha, you can show what we're doing here.
Peter, we're going to be using a little instrument that helps Dr. Nemias to figure out just how long your tooth is. Mm-hmm. I mention it, sir, because he's going to sneak the little holder under the shield, and it's simply going to rest on your lip or cheek for a few minutes.
As you can tell, our assistant is always checking on the patient and always informing our patient where we're at. We're going to use that number 1025. And the first canal I'm going to measure is the one that we found ourselves. So we have a pretty good idea of what we're doing. And you can see how we're measuring with the file. And I don't even look at the apex locator. This is all done by sound. That's the 0 point. And Martha, if you want to show the screen here, you can see this red line there. And I'm going to go past, and you're going to see that it's going to beep differently, and you're going to see this little red dot here. So we want to be consistent, up and down, and we're going to leave it at that length, which I call the electronic working length, which is the 0. Make sure that we go through, perfect. And this is a length that we're going to measure under the microscope, so we know exactly where we're at. We're going to measure it, and right now we're getting about 20.5. So I'm going to tell Tony that our working length for this canal is 20. I like to be a little shy on my working length for my files, a little shy of the electronic working length. But I'm going to have a patency file that is going to go through. Now I'm going to do the mesiolingual. Mesiolingual was a canal that we're retreating, maybe a little shorter. It seems to be a little shorter. Again, we go through, we pull back. Show it here on the apex locator, please, Martha. As I push through, 0, through. There is our length. We're going to measure it to that length. You can show on the screen now. We clean it because sometimes gutta percha will accumulate there, make it difficult to measure. Right now, this is about 19.5, so we're going to set up the mesiolingual at 19. Now we're going to measure the distal canal. Again, push through to the length, and that's our length. Very good. We're going to measure it, remove some of the gutta percha, and this is around 20.5. So we're going to measure it at 20. I'm going to go back again into this canal because I want to make sure that the length is where I want it to be. This one is a little sticky still. There's still gutta percha there. Very good. Perfect length. Let's push it through. Okay. So it seems to be that we're in good shape there. We clean it, and again, a little over 20, so we're going to go to 20. Now our patency files are going to be 1 millimeter to 2 millimeters past the working length. And the patency file is going to be a number 8. Can I have a little bit of calciness? We're going to use calciness, which is EDTA as a lubricant. And yeah, and give me a number 8 first. Okay. And we're going to see what our 8 is doing. We want to get it to 21, 21, 21, and the distal also 21 without any difficulty. So we make sure 21, maybe even past a little bit, just to remove any debris there. Give me a number 10 now, please.
10.
Let's make sure the 10 is the same. Very good. 21, 21, and the distal also 21. So now what we're going to do is we're going to clean the orifice, and we're going to use a rotary brush to clean that, as I'm going to be spraying some alcohol to remove some of the excess gutta percha that we may have in the pulp chamber. Tony is getting ready, and she hands me the yellow syringe, which is alcohol, and we're going to clean the orifice really well, because we really don't want any gutta percha there anymore. And give me a little more yellow, please. Yeah, we're going to see how nice and clean it's going to look once we're done with this cleaning. And you're going to give me a little bit of EDTA now. We're going to clean it with a little bit of EDTA as well. And now we're going to spray some water, please. Antonio is going to spray some water. Very good. Now, we're going to take a look at things. Give me the mirror. And things are going to look considerably cleaner than they were before. And we're going to start our irrigating protocol. We're going to use
Blue.
peroxide and hypochlorite alternating. And we're going to start our cleaning. This one you need to change, Tony.
Red.
This is hypochlorite. And you're going to give me a number, no, you're going to give me a number 8, please.
8.
Make sure that everything is looking good. Make sure that everything is good. And make sure that everything is good. Our patency files go to where we want them to go. Very good. Now we're going to use the Pro Glider file, which is a rotary file, very small. This is going to be used not just as a patency file, but also to create space for the larger files. You're going to go to 21 millimeters with this one. It goes to length, no problem. It goes to length, no problem. And it goes to length, no problem. Very good.
Would you like a 10 or an 8 in between, Dr.?
Give me an 8, please. And I always like to use a patency file as small stainless steel. Sometimes when I use the Pro Glider, I may not use this patency file, but for now we're going to use it.
Like
now we're going to use the wave.
Would you like it at 19 for the ml?
Wave at 19, please. Our working length for the mesiolingual is 19. So Tony is going to set up the wave to 19 millimeters. Her stopper is right there. And it goes to length without any issues. Now she's going to hand me the wave to the length for the distal
20.
and the mesiobuccal, which is 20. So see, this one is not going to length yet. That's okay. That's okay. Now, in order for it to get to length a little quicker, I'm going to ask Tony to give me some hypochlorite. So I'm going to be irrigating. Instead of taking the file and cleaning it, I'm going to be irrigating at the same time as I'm working the file. And this way, we clean our file at the same time as we're doing the treatment. Goes to 20, no problem. And the distal goes to 20, no problem at all, very easily. We're going to just check on our Orasil, make sure that it's nice. Very good. And I'm going to get a patency file, which is a number 8, to make sure that our canals are patent. This is the most important step of the treatment, to make sure that the canals are nice and patent and nothing is accumulating there. We're going to rinse, and we are going to increase the apical diameter of the canals, because the wave 1 is giving us an apical diameter of 25, but I like to always increase the apical diameter a little bit more than that, especially for a retreatment case. So we use peroxide, and right after the peroxide, we're going to use hypochlorite. We're using shorter tips right now, but at the end, we're going to change the tip of the hypochlorite to a skinnier, longer tip in order for us to be able to clean the canals a little better.
Do you like Streptonicol?
Very good. No, that's fine. This one is fine. I can see what I'm doing.
Gotcha.
Tony's asking me if I want Stropco to dry the canal so I can see better.
35
But
at 19.
here, I can see very, very well where I'm going. So that's 19. I'm going to push the stopper myself. So I know if I push the stopper all the way to the top, it's going to be 20. So these are vortex, and what I'm using is a 3504 in all the canals. And it's a rotating instrument. It goes to length, no problem, almost like butter. Like cutting through butter. Give me another 8, that one bent.
8.
So patency file, patency file, patency file.
40 at 19.
40 at 19. That's the mesiolingual. So Tony always tells me what she's going to give me. We don't play with the file. We just go to length. It cuts and we're out. Same thing for the distal and same thing for the mesiobuccal. Patency file.
like to
patency file.
rinse before pro-glide?
And give me the Pro Glider now.
Absolutely. Pro-glide is
So
fine.
Tony is going to give me the Pro Glider file, just to make sure that everything is good. Nice, nice, and nice. So all the files are going to link. So pretty much at this stage we have completed our shaping of the canals.
Blue.
This is as far as we want to shape them. Because I can tell that they're nice and shaped and trimmed to that diameter. We're going to use blue, which is peroxide, and now we're going to use an ultrasonic
Can you turn that
file.
to 0, please, Dr. Nemes?
And we're going to use the ultrasonic unit. And Tony is going to irrigate with a little bit of water as we do the ultrasonics. And this is a very flexible file. And we're going to go maybe a millimeter short of our working length. And Tony is going to be irrigating with water. Typically we have a machine that is connected straight. But today we had some issues this morning with our ultrasonics, so we're using a different unit. That's why you see the unit there at the back, and it's not in part of our counter. Very good, maybe 10-15 seconds in each canal. Excellent. Take that. And now we're going to start our irrigating protocol. We did the with peroxide,
Red.
we did the ultrasonics. Now we're going to do hypochlorite. Very good. We're going to check with our Dove gun plugger that this is going to the length we want to go. Very good. Excellent, within 5 millimeters of our working length. And we're going to try gutta percha points to make sure that they also go where we want them to go. So that's the mesio buckle, and we're going to check it. We're going to measure it now, and it should go to 20 or a little over 20 because I grabbed it a little higher than I should have. Let's do that again. Let's grab it right where we want to grab it, our reference point. And if it's a little past, we don't worry about it because we can use a larger gutta percha point. There we go, nice, to 20. And we don't see the reflection. And all of them should go to the same length. I don't take working length x-rays. We know that the mesiolingual should be a little shorter. We can tell it's a little shorter. And at the same time as we're doing this, we're pumping the solutions a bit. She's going to hand me the Pro Glider now as the patency file.
Pro-glide.
We want to make sure that we always have a patency file. We can either use the Pro Glider. I like using the Pro Glider. Or you can use a hand instrument. Can I have a number 8?
Absolutely.
Or we can use a hand instrument. But after each instrument or gutta percha or each trial, we need to make sure that the canals are nice and patent. Very good. Very good.
Calcinees.
Now we're going to use EDTA. So we use hypochlorite. The hypochlorite will dissolve the inorganic material, organic material, and now the EDTA is going to dissolve the inorganic material and open up the tubuli so we can get our solutions to where we want to. So that's EDTA. We're going to use a gutta percha point to activate the solutions, and also I like to use the endo activator to do the same. So the endo activator, we're going to use it maybe for about 20 seconds in each canal to length. So we're going to do 20 seconds now in this distal canal, and you can see how the solution is getting a little cloudy because the solutions are being activated inside of the canal. The beauty about this is that we can bend it a bit, making it easier for us to get into our canal.
Pro-glide.
That's the mesiobuccal canal. And now we're going to do the mesiolingual. And again, as with all the other steps, we're going to use the Pro Glide to make sure that the canals are patent, that nothing is obstructing the canals.
Blue.
Now we're going to start our third irrigant or set with peroxide, and
Red with
follow
long.
the peroxide. We're going to do hypochlorite, and Tony has bent the file almost to the working length, correct, Tony?
Correct.
So we like the bubbling effect.
Yellow.
Now we're going to use alcohol. The alcohol serves two functions. One is to dehydrate the canals, and the other one is to reduce the surface tension. So that way the hypochlorite, which is next, should reach a length a lot easier and faster, or more efficiently. A good test to show this is to put a drop of hypochlorite in a glass slab, and then follow with a little bit of alcohol, and you're going to see how it disperses the hypochlorite, because it reduces the surface tension of the hypochlorite. Again, we're going to pump the solutions with the gutta-percha cone, and we're going to use again our endo activator for about 20 seconds in each canal. Please don't hesitate to send me questions if you have any questions regarding the procedure and how we're doing this procedure.
Blue.
Again, we're going to use peroxide. This is the next step. So as you can tell, we use a lot of irrigants. Our irrigation protocol is quite strict and disciplined.
Red.
Now we're going to do, and Tony says red. When she says red, that means that that's hypochlorite. You can see the red marking on the syringe. And now we're going to use yellow, which is alcohol again, to start dehydrating the canals. We're going to use our gutta-percha point to activate the solution, the yellow, to make sure that it gets pushed to the end. And again, the last
Yellow.
irrigant is yellow. And this is before we dry the canals. How are you doing, Peter? Everything okay?
Awesome.
Very
Thumbs
good.
up, Dr.
Now we're going to dry the canal. We're not going to use the air directly into the canals. We're just going to very carefully with our stropo go around, and it's going to start to dry our canals.
Paper point.
Now we're going to use our paper points. And they should come out nice and dry. A little bit of the old sealer is coming out from the distal canal. So we are going to do something there. You're going to give me a 40/4, give me a bit of calcinase.
Sure. You're dropping?
Yeah, then give me a number 8 file, please.
8.
Now give me a 40/4, please. And then you're going to give me a 40 on the M4.
40/4 at 20 or 19?
40/4
What's the
20.
distal?
20,
Yeah.
right?
Thank you.
Because this canal being a little ovoid, maybe some of the old sealer is still there. We're going to remove it.
Want the 8 again? Before
The 8
40?
again,
Yeah.
and now the 40 on the M4. We're going to use a 40 file, K file on the M4. The M4 is a reciprocating handpiece where we can
40.
put our regular files, K files. So now we're going to use this, just brushing gently against the walls. You're going to give me the ultrasound again, Tony. the ultrasonic file, please.
Okay.
Give me a number 8. Again, patency file. Very good. And then we're going to use our ultrasonic file again to clean this a bit. And you're going to spray some water, please. Okay. Give me blue and red, and then the activator.
Blue. Red. I believe you wanted to look at the scan, Dr. Namias, in the display.
Give me the activator now.
Sure.
We're going to use the endo activator again in the distal canal, and we're going to use it for about 20 seconds. Give me number 8, please. Again, our patency file, making sure everything is patent. Very good. They're nice and patent.
Want the pro gliding on or no? You're good.
No, I'm okay.
Awesome.
Blue, red, yellow.
Okay, good.
So we're going to do peroxide, hypochlorite,
Red, long tip.
and yellow.
Yellow.
And then I got to put a shot point, please.
Pick a perka.
So we're again activating somehow the solutions there. And give me the yellow now.
Yellow.
And after the yellow, we're going to dry again. And we're going to look at that distal canal, and it looks nice. I don't see any remnants of sealer or all cement there. It looks pretty good. Give me the stroke. So we're again gently just drying things, and again we're going to use more paper points, and she's going to switch to smaller paper points in a minute.
Sorry.
We want to make sure that the paper points come nice and dry. They are coming nice and dry so far. And we're going to use smaller paper points. Nice and dry. Nice. Nice. All of them nice. Stroke, please. And we're going to put some sealer now, and we're ready to seal the canals.
Sealer and alert.
So we're going to apply sealer with a large paper point. And the consistency is important, that have it like it's sort of heavy. And we use Care Pulp Canal Sealer. And Tony's going to give me a 4004 gutta percha point.
Would you like a small gutta percha?
Because that's probably what I'm going to use. Give me the 4004.
Sure. 4004.
And they should go to 20. And it's right there at 20. That marking is 20. Give me the ruler just to confirm. We want to go to 20, and we're there at 20. There we go.
So
Give me the
Peter,
sealer.
for this part of things, Peter, you're going to notice a bit of a funny smell and a little bit of smoke as we melt a little bit of the extra material away with a warm instrument here. Okay.
We cement the point.
You're getting into the home stretch here, sir.
You're going to see a bit of smoke. We're going to use that at 300.
300.
And we will tap the material with number 9. Now we're going to go to the next canal, which is the mesiolingual, which we know the working length is 19, 4004.
Okay, gotcha.
And you see dead on at 19. Let's look at it under our ruler. But I tell because of the markings that we're dead on at 19. Look at that, dead on. Excellent. So I don't need to take x-rays with cones because I know my working length. I know where my cones are going. Do I get talk back? Yeah, I get a little bit of talk back. That's very good. And we're going to shear off the cone. And here it comes. And we use that at 300. Now give me a 4004 also for the distal.
4004.
I'm going to try 2 different cones here to see which one I like better. It's the 4004, maybe a little loose, but it is going to 20. I'm going to put some sealer. Give me an F4. I'm going to go to a larger cone with a larger taper,
F4.
same tip, which is. We're going to see if we're going to length. It should go to 20. There we go. Dead on at 20, getting a better talk back. So this cone fits better than the other one. Excellent. Very good. Now give me the system B. And we're going to sear it off. Now once we sear off all 3, we're going to obturate the canals or compact the material by using a smaller plugger. And we're going to reduce it to 100. And we're going to push, not hard, until we feel no resistance. And then I'm going to ask Tony to increase the heat. Go ahead.
3.
This is my separation burst. Out.
Second.
And I'm going to use a Dove gun plugger that I pre-measured before to push the material and prevent it from contracting. You see it goes to 15 millimeters, knowing that the canal is 20. Very good. Now we're going to do the same thing with the mesiolingual. Go ahead.
3.
I find that doing this in 2 stages like that with 2 different settings of heat, I pick up more lateral canals, and I don't go through the gutta percha like a warm knife through butter.
3.
Now we're going to do the distal, same thing. Go ahead, Tony.
3.
Almost to 19 there. That's okay. And we go. Very good. Very good. Now we're going to dry the canals with the Stropco. And we are going to put a little bit more sealer, just a tiny little bit of sealer for the interface between the gutta percha, and we're going to use the calamus unit. Can you show this, please, Martha? I am bending the tip of the calamus, of the needle. This is the calamus syringe, and as we press, the gutta percha is going to start coming out, and that's how we fill the top portion of the canals. And see the gutta percha coming. Give me a number 9.
9.
That's the distal. And now we're going to do the mesiobuccal and the mesiolingual. And I like to do them all in one shot. And I'm going to put a little bit more of the gutta percha. In order to see if there are any furcal canals. So we're going to fill up until we're done with all the gutta percha, the pulp chamber.
you're ready.
Now with a very large auger, we're going to condense it until it's hard to prevent shrinkage. Once it's hardened, we're ready to remove the excess gutta percha with a parapulse drill.
Straco.
Very nice, nice and clean. Everything looks beautiful. Very nice. We condense a little bit in the coronal portion. And we're going to put a temporary material.
Cotton. Another cotton. Need
Another
more?
one. That's fine.
You're good.
And Tony is going to give me some
Cabbage.
cabbage. We recommend our patients to go immediately after to see their dentist so they can get the temporary fillings replaced with a permanent one. And then most likely we're going to see Peter in about a month's time. We want to see already a permanent filling put in the tooth.